Hello, I'm Christopher Krafft, the head of the U.S. mission in Uganda. 2 days ago, Secretary of State Pompeo announced that the American people made a commitment of an additional $162 million for the global COVID-19 response, bringing the total to date to more than $1 billion since the outbreak began. Here in Uganda, we've already contributed more than $15 million, or 56 billion Ugandan shillings, to the COVID-19 response. For decades, the U.S. mission has invested in Uganda's health sector, including systems strengthening and preventing, detecting, and responding to infectious diseases. The fact that the government of Uganda's health system was well prepared to respond to COVID-19 was in large part due to years of close partnership between the United States and Uganda, along with U.S. government investment and support. In addition to our long-term support to combat infectious diseases in Uganda, the United States provided technical assistance and support to the Ugandan government for prevention and preparedness before a single case of COVID-19 arrived in Uganda. And as soon as cases began to cross Uganda's borders, we responded with additional support. So where does our financial assistance go? It is supporting the salaries of additional personnel, as well as critical equipment. It is helping to upgrade health centers with electronic data systems across the nation. And it is expanding laboratory capacity so that more testing can be done. We are assisting with the evaluation of new COVID-19 test kits, disseminating risk communications so that ordinary Ugandans get the information they need to stay safe, and supporting border screening to help identify positive cases before they enter the country, just to name a few examples. We've also directed funding to HIV services to ensure the safety of clients and health workers through training and updated standard operating procedures to address COVID-19. And we've contributed funding to enhance child protection, to support refugees and their host communities, and to monitor human rights abuses occurring as a result of the pandemic. The U.S. mission in Uganda has always looked at our partnership with the Ugandan people with the bigger picture in mind. Not only have we spread our assistance across many parts of the health sector, but we're also working with the Ugandan government and other development partners to support the Ugandan people, businesses, and institutions as they deal with the economic fallout of COVID-19. Today, I am pleased to announce that in addition to our $15 million in recent contributions, the U.S. Agency for International Development awarded an additional $10 million this week through the organization Give Directly. This will be used for cash transfers supporting tens of thousands of vulnerable Ugandans. This significant U.S. government contribution will help provide direct cash grants of $25 a month per adult in the most affected communities over a period of 3 months. As many people are reduced to eating meager rations and face the threat of starvation due to the impact of COVID-19 and necessary restrictions, the monthly cash grant will help them meet their basic needs. We're in this together, hand in hand with Uganda, like we have been for decades. And we are committed to continuing the hard work and support that is needed to fight this disease. I am confident that together we will succeed. Thank you.